I want to introduce another one, Ms. Taylor Moyer. Taylor is a devoted single mom of 3 young boys, ages 2, 3, and 7. She lives in Virginia Beach, Virginia, and after spending several years out of the workforce due to the childcare crisis, Taylor recently started a new job and is working hard to rebuild her family's financial stability. Despite her determination and steady employment, rising costs for housing, food, childcare, and beyond have made her family's budget extremely tight. For Taylor, Medicaid ensures that her children can see doctors, receive preventative care, and get the medical attention that they need. Without it, she says her family would struggle to access even basic health care. In addition to Medicaid, Taylor also relies on SNAP and WIC benefits to put healthy, nutritious food on the table for her growing boys. All of that is now at risk as the Trump administration and congressional Republicans stand in the way of ensuring costs stay down and relief goes to those who need it. While they make the biggest cuts to Medicaid and SNAP in American history, and while they refuse to use billions of dollars in contingency funds to extend funding for the SNAP program, even though President Trump can send $20 billion to Argentina and is trying to send another $20 billion. I want to thank Taylor for braving both 64 and I-95 to be here to tell her story today.
I'm Taylor Moyer, and I live in Virginia Beach with my 3 bright, amazing sons who are 2, 4, and 8, and all 4 of us rely on Medicaid for our health care. I'm a proud member of Moms Rising, and I thank you guys for the chance to share my story here today. When I became a single mom of 3, playing catch-up like so many other moms, I was pushed out of the workforce due to childcare crisis. Everything was a struggle. I took a job at a local nonprofit because I had to provide for my kids, but without childcare assistance, I could barely keep up. I applied but waited months for relief, and when I finally got approved, it helped, but not enough. Even with the assistance, I still pay $600 for only 2 weeks out of the month. For childcare, it's a constant balancing act just for us to stay afloat. As the cost of food and other essentials has soared, it's been harder and harder for my family to make ends meet. WIC is essential, and it helps me provide a balanced, healthy diet for my children. With 3 growing boys, the nutritious options that WIC supports are a blessing, and I'm thankful that I can choose from a variety of dairy, fruits, and vegetables that I'd normally say no to because our budget is really tight right now. Without WIC, I'd have no choice but to feed my kids cheap-filling options like ramen. They love it, but can't have that every night. And affordable, shelf-stable foods that aren't as healthy. I hope that lawmakers will ensure that WIC funding continues because every child and mother should have access to healthy food. As I said, my family relies on Medicaid for our health care, and it's no exaggeration to say it's a lifeline for my children and me. After my youngest son was born 2 years ago, Medicaid was the reason that I was able to access physical therapy for birth complications and counseling. Without Medicaid, I would have gone without care like I have done in the past because I really needed it. When I really needed it. Medicaid dental coverage for my boys is also a huge help, and I could have never afforded to pay for their dental coverage out of pocket. They would just go without it. A lot of families do go without dental care because when you're choosing between putting food on the table or going to the dentist, most families are going to choose food. But dental care is essential to our children's health. Even with Medicaid, accessing health care is enormous, sometimes insurmountable challenge. For instance, the clinic that I used to rely on no longer accepts Medicaid. And because so many health care providers in my area don't accept it, finding care is a struggle. Even now, more cuts to Medicaid looming, the program doesn't cover all of our needs. I need eyeglasses, but I can't find it. I worry that the deep cuts to Medicaid that Congress passed will make these problems even worse. Lawmakers should be looking for ways to improve our care, not cutting programs that help us build good lives. On behalf of my family and so many others, I thank all of you who are working to strengthen our care economy and protect our health. So many hardworking families like mine are barely scraping by. We're terrified about what the cuts to Medicaid and the Affordable Care Act premium tax credits will mean for us, and we are desperate for solutions for our country's child and elder care crisis. For my family, the looming health care cuts are an emergency. I don't understand why Republicans and so many private donors are spending hundreds of millions of dollars on a ballroom while the health care of my sons and I and so many others rely on is on the chopping block. Families like mine want Congress to reverse the reckless and damaging cuts to Medicaid and extend the premium tax credits that make health insurance affordable for tens of millions of us. At my job, I see every day how the issue affects people from all walks of life, not just one group, but everyone. My peers, my coworkers, and the people that we serve are all struggling. We're hardworking. We're serving our communities, yet the government isn't holding up its end. Working class families can relate. So many working class families can relate. But how many elected leaders have ever worried about putting food on the table or paying for their children's care? That's a reality that so many of us know way too well. Our children are our future leaders, thinkers, and innovators. Please make meeting their needs and keeping families healthy a top priority. Thank you.
Thank you so much, Taylor.